Hello everyone, it's Dr. Manjari Narkani live from the Blue Water Nutrition page, and today we are talking about vitamin D. So, we've started a new series known as Wellness Wednesdays. I'll show up live every single Wednesday at 1 o'clock in the afternoon to discuss a health related topic. And if you have any questions about it, you can always post it in the comments and tag me and ask me any questions that you have. So, for the very first Wellness Wednesday, we're going to talk about vitamin D and everything you need to know about vitamin D. So, if you are watching this live, you can say a quick hi. If you're watching this as a replay, you can put a hashtag replay so that I know you have watched this video. And this is a series to help bring you some health related information so you feel empowered with all this information and take charge of your health. I can see a few people tuning in live. So if you can see this live, just say a quick hi and I'll be more than happy to answer any questions that you have. So, yeah. So let's get started. Vitamin D. So, what exactly is vitamin D? Vitamin D is a nutrient as well as a hormone that our bodies make, right? So, when we talk about vitamin D, no one is quite sure. We talk about it as vitamins, but it's also a part of our body. Our body can synthesize vitamin D, and it is, in fact, a hormone and has a lot of functions in the body. It is fat soluble. That also means that you need good amounts of fat in the body or healthier fats to be able to make this vitamin D. And it has a lot of different functions like helping with calcium absorption and phosphorus absorption. It helps with bone building. A lot of laboratory studies have also shown that it's extremely important for your immune health. Vitamin D in the lab has been shown to reduce cancer cell growth. It can also help control different infections and it also reduces inflammation, right? And a fact is that most body's organs as well as tissues have receptors for vitamin D, and that itself suggests that there are a lot more roles to vitamin D than just your bone health, right? Hello, I'm not able to see you. I know a few people have signed up or are saying hi, but I think because I'm live in my group as well, I can't see. So I'm saying hi to everyone there, though I can't see your names with the platform that I'm using. So this is extremely interesting when we talk about vitamin D, especially when we live in North America or when we live in areas where there's not enough sunshine, our bodies are not making enough vitamin D. And those could also lead to certain signs and symptoms where you feel a lot of fatigue. You could have a lot of bone and joint pain. You could feel tired. You could have bone aches. You could have hormonal imbalances as well. Hi, Bonnie. Nice to see you. So these are all the importance, like this is all the importance of vitamin D. And vitamin D is something that can be synthesized early in the morning. So if you go for a walk, try to go early in the morning, probably around 6 o'clock or 7 o'clock before the sun's rays start getting extremely harsher. And that's when you can actually absorb the sun's rays and make your own vitamin D. Now, there are two forms of vitamin D. There's the D2, that's known as ergocalciferol. There's the D3, that's known as cholecalciferol. And D3 is the active form that we get from the sun, right? So the minimum exposure you need is 20 to 30 minutes to make your own vitamin D. And in just about 20 or 30 minutes of exposure in the early morning sun, you can make as much as 20,000 international units in 48 hours, right? And that's for people who are light skinned. If you have a darker skin tone, you will need a little bit more exposure. You will need a little bit more because you're not going to make enough vitamin D as compared to somebody having a lighter skin tone. And that's also why you need a little bit more exposure to the sun rays earlier in the morning. One of the ways that you are out in the sun, but you're not making vitamin D could be because you're applying a lot of sunblocks, right? So if you're applying sunscreen or sunblock, you're not utilizing the sun's rays. So again, the ideal situation would be to wake up early in the morning, 6 o'clock, 5:30, when there's earlier sunrise, and just go out and about. And that will help you absorb the sun's rays and make vitamin D. So typically, an average person makes about 1,000 international units a day. The unfortunate part is we all spend a lot of time indoors. We are all indoors in our houses, in our cars, or in our offices, and there is not any exposure to sunlight. In Canada, in the colder regions, even if you go for a walk in the morning, chances are that you're completely covered and your skin is not exposed to sun. And that's when you're not making any. And that is where supplementation with vitamin D plays an important role, um, for helping prevention of different conditions and also helping you boost your own immunity, right? So there are different studies that have been done over the past few years, and one of the studies has linked low levels of vitamin D to type 2 diabetes. There's a study that shows that having enough vitamin D in your body can actually improve insulin sensitivity in your body, which is critical for developing type 2 diabetes. Also, that type 1 diabetes, which has an autoimmune component, can be related to vitamin D because autoimmune conditions are seen to be much more in countries where there's not enough sunshine. Countries that are far away from the equator, countries that have shorter days or not enough sunshine, are demographically seen to have a lot more incidences of vitamin D. So there is a definite link between autoimmune conditions as well as vitamin D, low levels of vitamin D, right? So these are a few things. There are different studies when we talk about colds or flus or any kind of upper respiratory tract infections. Vitamin D deficiency is also seen as a common factor. And there was a Japanese study where taking 1200 international units a day actually lowered the rate of flu by 58%, right? And there was also a study done in the archives of internal medicine where people having the lowest levels of vitamin D were more likely to suffer from colds and flus, right? So right now, because we're also in the middle of a pandemic, we're also trying to take care of our own immunities. If you are someone who's not going outside, or if you're sensitive to the sun, if your skin is extremely sensitive, try supplementing with vitamin D, which is extremely important not just for your body but also your immunity. There is again link between vitamin D deficiency and your innate immunity as well as your adaptive immunity, right? And with vitamin D also at cellular level, it favors differentiation over growth, right? And it also inhibits any kind of abnormal cell growths, which leads to tumors and cancers. And this is another benefit how taking vitamin D or supplementing with vitamin D or getting enough vitamin D is going to be really beneficial to you. How to know if you're low in vitamin D? So this is a question I get asked a lot. If you are extremely tired, if you have joint aches or pains, if you have a lot of unexplained fatigue and really muscle pain, you could be low in vitamin D. Also, vitamin D deficiency has been linked to mood disorders, especially depression, right? So one of the easiest ways is to get it checked through your medical doctors. You can go for a blood test and they can also help you figure out your vitamin D levels, and you might have to pay just something like 25 bucks, but you get the test with the accurate results of what your vitamin D level is at. So Sarah's asking me, do sun lamps help during winter? Yes, they absolutely do. And I have used sun lamps and I've seen a huge difference in my own mood because I get pretty sensitive to not having sun, and I've lived in sunshine most of my life, 27 years, and suddenly not seeing the sun for long months is challenging. I'm also hosting this from my home. So if you see the bright yellow wall, I've painted my house bright yellow, at least two of the rooms where I spend my most time. So this helps me, keep my mood really vibrant during summertime. But sun lamps, absolutely, they do help. Now let's talk about how much vitamin D would you need, right? So typically the recommended dose is 1,000 international units, but a lot of studies show that that is the maintenance dose. That is not the dose for filling up your deficiency. That is the dose to maintain your vitamin D if you are lacking in vitamin D. Sorry, not lacking in vitamin D if you have enough reserves. If you are lacking in vitamin D, you could end up taking safely 4,000 international units of vitamin D. and that will show you a lot of change in your mood as well as help support your immune system, right? The children's dose is about 400 international unit. You can work with a nutritionist if your child has recurrent infections or recurrent um, health issues. You can definitely work to increase the dose. When I work one-on-one with clients, sometimes I also do high doses of vitamin D, 10,000 international units, sometimes up to 20,000, but that is after knowing the history of the client and working one-on-one with them. So ideally, people can take up to 4,000 international units on a regular basis safely. Vitamin D is a fat soluble vitamin, so excess would be stored in your body, but that rarely happens because most of us are deficient, right? So, this is a little bit I wanted to explain about vitamin D. So, everyone who's shown up here, thank you so much for showing up live. If you have more questions, you can always post it in the comment section. Feel free to visit us at Blue Water Nutrition. We have lots of vitamin D. We have different kinds of sprays as well as different pills or drops that you can take as per your preference. So whether you're looking for a vitamin D for yourself or your child, we have all the supplements that you need. Again, if you have any questions, just you can comment on this post and tag me and ask me any questions that you have. So thank you all for watching this live. I'm glad I could interact with a few of you during the first of our Wellness Wednesdays. And I'll be back next Wednesday exactly at 1 o'clock with another interesting topic on immunity. The theme for August is boosting your immunity. So we're talking about different topics that are related to your immune system. Thank you for watching this live, and I'm signing off now. Have a fantastic day. Bye for now.